welcome back to our next session at the Geneva Health Forum, this time led by the Novartis Foundation. The question we are trying to ask now is, how can the world advance towards AI maturity in health? A few quick points to note here. This panel is actually inspired by the AI in Health report by the Working Group on Digital and AI in Health by the UN's Broadband Commission. The report was launched in September this year, and it introduces an actionable framework for policymakers to advance in the level of AI maturity of health in their respective countries. Now, leading us through this discussion is going to be Lucy Setien, who's the Associate Director of Health Tech Innovations from the Novartis Foundation. And just before we dive into this, we'll be playing you a very short video by them.
Audience and panelists today joining the discussion around health and artificial intelligence. Now, today I'm surrounded by a panel of people, some of which had some big secrets to share to us today. And I think it's no surprise that I'm going to introduce four fantastic people working in the domain of health and technology together. So I would like to introduce you to Dr. Kwasi Boahene, Director Advocacy and Program Development and Director of West Africa at Pharmaxis Foundation, followed by Dr. Rupa Dutt, Executive Director and co-founder of Women in Global Health, Kanishka Katara from PAT, Head of Digital Health India, and Derek Munin, Head of Capacity Building and Collaboration at the World Health Organization. So let me start by asking all of you, this year surprised us quite a lot. What was the largest potential you saw when thinking about artificial intelligence in your work today? Please share a few words about your organization, what do you do, and how this year brought some new thinking around AI and health. Let's start by Rupa.
Great, thank you, Lucy. And one of the things that this pandemic has really done is magnified existing inequalities. We know that there are inequalities in our society, but when it really comes to health and gender equality, the pandemic has magnified inequalities. And what we have been doing at Women in Global Health, which is a global movement bringing together women and allies to advance gender equality and global health leadership with over 24 chapters around the world, is really using the virtual platforms to stay connected and to advocate on gender equality. And what we're really excited by is the fact that there really is an opportunity to accelerate digital health and accelerate innovation. And we have teamed up with Novartis Foundation to put together a Build Back challenge, which really is focused on ensuring that gender equity solutions are being put forward and also solutions that engage women as innovators. So not only the recipients of the technology that are being made, but really being the co-creators. So for us, this pandemic has magnified and the existing inequalities that we've already been advancing. And now there is finally much more broader societal interest in working in health and much more broader societal acknowledgement of the gender inequalities. And so we've been really working together with partners to link up those that are really savvy in this space and bring the women's perspective and engaging new women to work on innovation.
Fundamental contribution, because inequality comes in many different shapes and forms. And often when people think about artificial intelligence, they don't realize that it can bring about quite a lot of inequalities as well. Let me ask you, Kanishka, what are some of the considerations that you and your team have faced when working in the space of AI for health when we're talking about inequalities?
Absolutely. I think this is an absolutely pertinent point in today's age and world. And, while all of us have suffered, the entire world is suffering because of COVID, there is there is still a silver lining somewhere on the horizon. This is possibly for the first time that COVID has arm twisted all of us, including me, including all of the panelists here, including all of the audience and the governments globally, to consider the advanced and more sophisticated technologies to be adopted for the larger impact and for the larger good of the society. This has suddenly diminished because of the adoption of the latest technologies and specifically AI and the far end of the technology spectrum. It has suddenly diminished, what gender, race, caste, creed, one is coming from. It has suddenly brought everybody on the same panel and on the same level. I've been a big critic of digital myself, even though I lead the digital health portfolio for the India program. And I've been a critic because I have felt that digital world hasn't done enough to bridge the gap when it comes to public health challenges. We look around, we see other sectors, aviation, finance, banking, etc., and we see digital in a very different light. And let me give you a quick example. So when any of us open a new bank account, is it even a question on the table that the bank will not offer net banking services or will not offer us a credit card or any of the digital mechanisms? It is not. But when it comes to a public health program, that question is still on the table. Okay, what we will do digital, to help improve the impact of the program or to help bring in more equality amongst the society, specifically the marginalized sections. So I think, the current pandemic has been a golden opportunity, or at least a silver opportunity in a good way, to bring everybody together and to also arm twist people all around to understand how digital can help people, be on the same platform.
Thank you, Kanishka. That's been absolutely true. I couldn't say it better than that. And we have seen throughout the report on AI in health, one of the core pillars actually around AI in health is partnerships and also thinking about regulations. And what comes often across in the conversations I have been having with experts such as yourself is that in regulations, we're not only thinking about creating equal opportunities and shared benefits, but also that the question around trust comes quite often. So I'm wondering, Derek, in your work, how do you express the topic around trust and artificial intelligence combined with the real health outcomes that are measurable and value driven?
Thanks, Lucy, and thanks for having me here. And viewers, morning, afternoon, or evening. Lucy, the question you've asked is a very important one because we really cannot accelerate digital health if key issues around trust, confidence in the health system are not addressed. And so part of what we're looking into is to really support our member states around creating some governance arrangements for digital, including AI. This is an odd field, Lucy, as you've rightly pointed out in the Broadband Commission report. AI has been with us for about 70 years now, since the 1950s. Key issues now is really how do we encourage governing bodies to uptake AI in such a way that it is reliable, safe, and also equitable. We just, had member states approve our global strategy on digital health last week, and this is really sitting upon our instrument of digital health implementation, the National eHealth Toolkit. One of the key pillars there is regulations. And so we see this opportunity to fast track this regulation pillar so that our health seekers are able to gain confidence in the health system. Now, keep in mind that we're coming from an age where most of our health seekers did not have confidence in digital tools. They preferred to, use manual records. But right now, because of what the pandemic has taught us, providing us with, for example, digital tools that are patient-facing, we now have digital tools that require a patient to utilize, such as telemedicine. To be able to succeed, we need to ensure that there's good governance. We need to ensure that the member states have appropriate regulations at national level to support data protection, including data in transit and data at rest. These are key principles that would really ensure that digital health and AI are implemented in a safe, equitable manner, and that we ensure that we're reaching everybody where they are, leaving no one behind.
Thank you, Derek. You've been touching a very, very interesting point actually around the topic of data and governance. And I know that also the team of Quasi works quite a lot in the field with data. I'm curious, how do you leverage data in your work to demonstrate measurable health outcomes which can help policymakers make data-driven decision making?
Yeah, thank you very much for having me on this important forum. So, like you said, we are involved in making maximum use of data, and we do that at various levels or with various instruments. So, one of the things that we do is partner with researchers, and so they can be international or local researchers, and I mean the countries where we work. So the researchers will do impact evaluation about the effectiveness of the work that we do. The other side is also the data that we collect from the programs, because impact evaluation will normally take maybe 3-4 years to set it up and get the information. But daily we get data. So the data can be on the epidemiology of the context. It can be on utilization of services, the income levels of people. And so with the data, you'll be able to see, for example, who can pay for health or not. Because what we see in most African contexts is that because a considerable majority of the people live on like $1.50 a day, they cannot fully pay for health. So they need support from their governments. But the governments also don't have enough money to pay for everyone. So then it's important by using data to segment the population, that you can tell the government that on the basis of the analysis, this is the group of people, that need help or subsidy to pay for insurance. This is the group of people that can pay for themselves and maybe pay extra for other people. And so this is just one example of how you can use data to bring in more money to finance care. And I think when we talk about data, that is part of the story that is not often told. Of course, we can also use the data to improve the delivery of the services. How many pregnant women have missed their antenatal visits. If you're monitoring that, you can also feed that data into the delivery of care and give proper advice to the clinic as well as to the women who need the services.
That's exactly it. Often we seem to forget that it's all about, in the end use and the people who are going to benefit from the actual solutions and the actual AI models that we are trying to put in place. It seems also that the role of the ecosystem is quite important. I'm just wondering, Mary Q, why don't you share a little bit about the work you do with the ecosystem and how are your members creating the right links so that these kind of innovations can be appropriately tested, but then also sustainably deployed?
Sorry.
Do you think this is something you know?
No, there was a break in the communication. Could you repeat the question?
Connection, broadband connectivity. Yeah. Mm-hmm. So I was wondering if maybe Derek can comment on what's actually needed to create the right ecosystem environment to support this kind of innovations.
Thank you so much.
Sorry? Yeah.
Yes, Kwesi. Go ahead, Kwesi, and then I'll comment after.
Yeah, okay. No, please go ahead. I thought it was a question for me.
Yeah, I was very happy to share the question with you, Kwesi. So I'll make a comment and Lucy will take the discretion to get further contribution. Very exciting topic, actually. Lucy, the question you've raised is an important one because we're coming from a period of fragmentation. And then the question around an integrated ecosystem is important. We already for the past 5 years been articulating what are the enabling building blocks for a digital ecosystem that is cohesive, representative, an ecosystem that is also universal. So the odd topics that we've articulated in the past require strengthening. Issues around leadership and governance, issues around making sure that there are curated applications that can support the health needs, to make sure that the health, results are actually consistent with what is expected. Issues around standards and interoperability, infrastructure, legislation, and workforce. But beyond that, these kinds of pillars I've talked about create an enabling environment at the country level. But then at a global level, what we're really supporting is this amalgamation of partners that play different roles in support of the ecosystem on digital. So we're talking really about the private sector engagement. We're talking about the academia engagement, NGOs, member states themselves. We're really talking about, the civil society. All those actors that have a contribution within the digital health ecosystem to ensure that digital is not fragmented. So we're working on a concept at WHO called a network of networks that is intended to amplify existing efforts, elaborate them, and making sure that we're leaving no partner behind. And so this formation of an ecosystem that is representative ensures that we're all marching in the same direction, addressing the same global health challenges, leveraging our efforts, and then building upon what has actually worked, such as the existing collaborations around data. Well, that's what Kwesi was articulating himself quite eloquently when he was talking about data. There are data collaboratives. There are existing, networks that are really specific to an area, whether it's academia, NGOs, and etc. So this ecosystem at global level is really critical to just ensure that we leave no actor behind, and more importantly, we are fast-tracking the global health strategy on digital health, whose pillar, or at least one of the objectives, is supporting global collaboration. So Lucy, this question is important, and other members on the panel might want to add, and I noticed Kwasi was quite keen to make some comments, but I just wanted to stress the fact that at WHO, we're really interested in building this network of networks to make sure that we have a responsive, agile, resilient, global digital system that supports health activities at national level. Thanks, Lucy.
Thank you so much. And I'm wondering now, Kwasi, if you want to comment anything in addition to this?
Yeah, so you said it all. When it comes to regulations and creating the enabling environment, what is also important is that sometimes we don't know how to organize this, and there governments, because governments will always want to appear to be in control, they will then think of regulations. But sometimes you can just let things organically develop, and then see, what you can learn from it. And I think a nice example is what happened in Kenya with M-Pesa, that when they started, there was no regulation, but there was a good understanding between the government and the private sector. In this case, Safaricom, say, okay, we don't know, but please, make sure that certain key principles are respected. And so then the lessons from the achievements of M-Pesa help the government to develop a more effective legislation. And so that's just something that I want to say. In order to, the other part is also getting the trust of the people. So you can have regulation, but if people don't have trust in the system, it won't achieve much. And we've seen how mobile telecom providers have been able to transform the economy, because they deliver service and people have trust in the service. So it's important to let the things sometimes play out a bit.
No, I love how you're talking about actually complementarity of, I would say, skill sets, but also resources and ways of thinking in these kind of networks such as the one that WHO is launching. And I'm looking now at maybe Rupa and Kanishka. You also work quite a lot on the different aspects around artificial intelligence or technology at large with the benefit of health system strengthening. Can you talk, maybe Rupa to begin with, can you talk a little bit more about the non-technological aspects which are important to address in order to sustain this in the future?
Yeah, thank you, Lucy. And I think just going back to what do we want our ecosystem to really look like, and our ecosystems need to be equitable and they need to be inclusive for it to be truly this innovative environment. And so, just giving you some idea of like how technology currently is working and how innovation, and particularly when you look at artificial intelligence research, only 12% of artificial intelligence researchers are women. And when you factor in tech giants, including Google and Microsoft and IBM, less than 15% of those projects are led and have women really being the drivers of it. And so we know that, if you don't have the 100% of the talent pool in health really engaging, we're just not going to get the best solutions. So looking at the field of global health and particularly health systems, as Lucy, what you were alluding to, we work very closely with the World Health Organization on the Gender Equity Hub, which focuses on the health and social workforce. 70% of the health workforce are women. Less than 25% are senior leadership roles. And then when you put this, new number of 12% of artificial intelligence researchers include women, we know that we're losing the talent pipeline when it comes to innovation. And so the way to create the ecosystem that truly is innovative, we need to hardwire diversity and equity into all of our aspects of innovation. And so the first thing is that, really making sure that we have people from diverse backgrounds. So one is ensuring girls and women are getting exposed early on to digital technology, to innovation. When you take a look at the global world's population, 1 billion women currently do not have access to digital mobile technology. That's a pretty large number to say that, we're going to work on achieving universal health coverage and health equity when 1 billion of the world's population does not even have access to digital technology. The second is really about making sure that they're getting to co-create. And what we mean by co-create is that as problems are being defined and solutions are being, put together, and we've heard about having people-centered design or human-centered design in this process, how often are we really making sure that the co-creators of this process are people from diverse backgrounds? So that includes women, but also including people from lower middle-income countries who are often the target of the solution, but rarely part of the design and the decision makers. And then the third part is really taking a look at, where is there potential to harness in using technology to fill some of the greatest gaps. We know that there's an 18 million health worker shortage by 2030 in lower middle income countries, 40 million globally. And this pandemic, as we've talked about, magnifying inequalities, it's also magnified opportunities of accelerating innovation to fill the health workforce gap, to augment what health workers are doing, who again are majority women, who have to not only provide health care, but they also have to provide care for their families and their communities at higher and higher rates, especially during this pandemic. So really thinking about, we know there's global challenges to fill, especially when it comes to health workforce, and how can technology really, artificial intelligence, augment and provide increased access, but also increased support to the health workers. And then finally, I'd like to say that, an aspect of hardwiring, and this is really my call to action to all of you that are tuning in that come from the innovation background, and I, thank my colleague for bringing the example of Mompeza, is the fact that 50% of what women do in the health sector remains unpaid, and it's in the informal sector. And if we could actually formalize these jobs and have appropriate compensation and use some of the fact that women do not have access to digital technologies to think about how do we make sure money is getting into the hands of women for the hard work that they're doing. And so the health sector is one of the most gender inequitable sectors, and really artificial intelligence has a huge opportunity to support with solution creation. And that goes back to that ecosystem where we truly hardwire equity and bring all the diverse perspectives to the table from the beginning.
Thank you so much, Rupa. And Kanishka, you also share certain views around that, I believe, because we have had a long discussion with you about the scale of India and the different disparities in the different regions of India, being like a country of many countries. Can you talk a little bit around bringing the topic of equality into the picture and affordability as well, given into account that not all things are equal, unfortunately?
Absolutely. And Lucy, I am not really sure if I can add much to what Rupa and Kwasi and all the panelists have already shared on this. But what I will share is possibly let me start by giving an idea about what India is, because I think that really is important to understand. In one, India is a subcontinent. It and I'll compare it with the EU for a just to set some context here, because when you say India is disparate and these are separate regions, we need to understand what we're talking about. So again, I did some research, and possibly these are slightly older numbers, but for example, EU, the total population is about 450 million. India's population is about 1.3 billion. Number of member states in EU are about 27. India has about 37. Language diversity in EU is about 24 languages. India has about 20 to 23 nationally official recognized languages. Health as a subject, again, because EU is a composition of different member states, it's a country subject. Similarly, in India, it's a state subject, which means 37 provinces of India can have their own state policy around health, and the central government provides a guidance framework, whereas the implementation is a state subject. Further, the population of India doesn't make the equality argument any easier. It's been a long trodden road for India as well to bring everybody on board, and still we are learning and we are evolving. But just to give some context here, Uttar Pradesh, which is India's largest state, if it was a separate country, it would have been the fifth most populous country in this world. And that's just one state of India. So, in a nutshell, a number of these provinces of India are as big or possibly bigger than a lot of other countries in different parts of the world. And you can imagine, with such a diversity available in one single country, it's not really a reasonable argument to have one single stop shop, because there are so many cultures, so many traditions, so many benefits, and so many challenges also, or problems which we have inherited traditionally, which are right on the table. Coming from a digital background, I mean, my argument always was that, why not? Of course, digital is the great leveler all around the world, and we should have the same standards when it comes to public health. And I will draw on an experience which I had. So I was leading possibly world's largest mobile health deployment which has ever happened in India. There are about 630,000 frontline workers, and all of these are women from different sections of the society who are spread across the country. They have been equipped with a smartphone, with a mobile application to provide maternal and child healthcare services, and this has been done in very close partnership by government. So government has procured smartphones and connectivity, and they have provided to these workers. And I was leading that assignment. We helped prepare the software application to which enables these workers, these ladies, to deliver services. When we started out with this program, Lucy, again, a very software oriented approach, a very standard view that, okay, this is the definition, this is how we roll out the software in a country like India, and it should be one standard across the country. But once I started traveling the country, I started realizing that it is unfair, not only on my part, but also on part of the system, to expect that what works in the northern part of India will exactly work in the southern part of India, or what works in the western part of the country will exactly work in the eastern part of the country. It is not like that. So when it comes to digital and AI specifically, I think it's really important to understand what is the context we are talking about. Contextualization of the problem is really, really important. We need to understand what is the problem we are solving, for. At the surface, a lot of problems can appear to be, in the same shade or in the same color, or they appear to be a similar problem. But you just need to scratch the surface, and we will realize that in public health, the issues from one place to other place, even though they might appear to be the same, they are very different, and they need more contextual and more localized solution for that. So that's one. The second is, and Rupa really very rightly touched upon it. I think user engagement is absolutely important. We see so many systems all around where people like me, people like Rupa, people like Kwasi, people like Lucy, and of course, our government partners also end up designing a system in a manner which suits us. Whereas the user of that system, which we are designing, is out on the field. And that lady or that frontline worker possibly hasn't held a mobile phone in her entire life so far. And I have met such workers in the field who have been in service for 30, 40 years. Forget about a smartphone. They were handling a mobile phone for the first time. And you can imagine, if somebody like me had designed that system, they would have been, all lost all across. So what we did was we actually engaged the users in designing the system. It took us about 6 to 8 months, but we stayed with these workers. We let them design it on a piece of paper, and then we replicated that design as far as the software solution is concerned. And everybody was very skeptical. Of course, our government partners were also very skeptical that this is not the way softwares are designed in India. But unfortunately, that's the view which corporate software industry has always given to the government partners. And very naturally, we get biased. Humans are biased completely with whatever we know. But once this was done, and I really thank the government partners for having that faith and having that patience, to see how the system has evolved. This became a hugely successful system. From an initial 100,000 user pilot, it became a national system. The target is to reach 1.4 million workers. It is roughly at 50% right now. So user engagement is absolutely important. The third point I would like to highlight in terms of sustainability is what is the ROI? What is the problem? Again, drawing back to the problem, what is the problem we are solving? And it should not be that we are trying to reach the moon, whereas we don't even have the rocket, or the vehicle to reach travel between Delhi and New York, or Delhi and Kenya. We need to solve one by one, of course, have the larger vision. But before we aim for a artificial intelligence kind of a solution, we need to understand that we have the basic building blocks in place before we can aim for that. One thing which, again, very unfortunately, I see all of us miss, and when I say just not the people in this forum, but everywhere all around, is when we talk of sustainability, we typically end up talking only in terms of financial sustainability, that who will fund this. Today, this is getting funded through one of the donor partners, or through, WHO or any other mechanism, or even the government is funding. What happens tomorrow? My argument is slightly different. I want to emphasize that we also need to look at the programmatic sustainability of the initiative, because once the value of the initiative is put on the table, the evidence is there, and it becomes inseparable from the core program, then the sustainability is already taken care of. Once the users feel that it is helping them as a job aid and not as a job ad, governments do look at the value, whether willfully or through a force of nature. They look at the value, and governments are able to find the budgets to provide the sustainability and support to any of the initiatives. But with that, I think last but not the least, I think COVID again is a golden opportunity in my way to push through the digital agenda, and governments are more receptive now. I mean, the type of reception I have seen from the government partners in the last 6 months, I'm pretty sure I would have spent another 5 years to reach this level. Today, the governments globally, I think, are more open to adopt digital than they ever were. Now, I see a different attitude, because I think pandemic has opened a lot of eyes everywhere. Over, Lucy.
Thank you so much, Kanishka, and absolutely congratulations for all the work you have done. That sounds like an absolutely fantastic piece of work, and an example to be shared to other governments as well, as a best practice of implementing, not only creating an invention, but also innovating in the model you deliver it. You raised an interesting point when you were explaining about the mobile phone and how actually the person wasn't even sure how to yet use that, which often comes back as one of the key questions around artificial intelligence. Will artificial intelligence take my job as a nurse or as a healthcare worker? Should I be really worried about that? And it often raises the question of continuous education, retraining, getting new skills. And the answer was, like somebody said, it's not about AI replacing healthcare workers, but replacing healthcare workers without AI. And I'm looking at Derek. I know that the WHO is doing quite a lot of work around education, in continuous skill building around technology. Can you share a little bit about that?
Yeah, thanks, Lucy. That's a very pertinent question because normally technology comes with the threat of replacing existing skills. And whereas at the global level, we'll be promoting the fact that technology is there to enhance existing processes, we must be cognizant that the user might be having a different perspective. And we've seen this throughout the evolution of technologies. When typewriters came to the scene, people that were, creating paper documents manually saw the typewriter as a threat. And when word processing came to the field, we had to ensure that people that were keyboarders on manual typewriters were comfortable enough to feel like the word processing packages are not only going to enhance their productivity, but there's a space for them to build their capacity. And so we must remember that the user is keen, and especially in health, in the health area, the issues around having a skilled health workforce that is both adaptable and that has a prerequisite skills to use digital is important. And I emphasize this because systems break when the end user that is supposed to be a change agent is unable to use the system that we're promoting, or indeed has a resistant attitude. And so we fail for taking this assumption for granted. And it's extremely critical to ensure that we are thinking about the competencies that enable the actual users to use the digital systems. So we have an ambitious program at the WHO consistent with our global strategy. I keep coming to the global strategy because that's our instrument of work for everything that we do. And this really speaks to the need for us to have a digital health, literate health workforce that has the prerequisite ICT skills. And that actually also refers to the health seekers themselves, because the end users sometimes have to interact with a system, such as using a digital device. And so our approach at WHO is to have this global competency framework that looks at the three aspects of digital health competencies, the required cognitive issues that are needed for the health workforce to be able to articulate, define, and say what is taking place in the digital health ecosystem. The second pillar is around having the appropriate skills to actually use the systems that are being deployed. And then the third pillar has to do with attitude or application. And so this framework is built for educators on the core on Bloom's taxonomy that really looks at competencies being built around knowledge, skills, and attitudes. And there's a number of programs that we are building out that enhance this learning journey to provide lifelong learning opportunities for the health workers. And this includes both health workers that are in pre-service mode and those health workers that are in-service mode. And so we're looking at the spectrum of all actors, decision makers, practitioners, frontline health workers, together with the actual population. It's a key area because these are change agents. We really cannot achieve digital transformation if the health workforce itself is left behind. So when we speak about leave no one behind, within the spirit of universal health coverage, we also speak about leaving no one offline. And then this is, an important area quite personally, because when I started off in my career in digital health, I was involved in training, building competencies in health workers. 20 years ago, thinking about computers in the health facilities was unimaginable. I dealt with health workers who had to sweat in their palms by holding a mouse. This was 20 years ago. And so looking at where we are right now, because of the availability of mobile devices, hardware in health facilities, the key issue that we now have to address is how do we ensure that the pipeline of the health workforce has the required skills to implement the change that we are looking after. And I just want to piggyback on what Rupa was talking about in terms of designing with the end users. You see, we have a set of principles called the principles of digital development. And principle number 1 says design with the end user. Now you see, the end user can only design with you if they're speaking your language. So as far as they're concerned, without being trained, if you show them a mobile device or a computer screen, As far as an untrained health worker is concerned, that is a picture. The technician can see in that picture tabs, buttons, icons, all separate things. But as far as the a health worker that is not trained is concerned, what you are seeing as an application, they are seeing that as a picture. And so this transformation of digital health requires that the health workforce itself has the necessary competencies to use the digital solutions and to catalyze the change that we're looking for. And so lastly, the instruments that we are looking into harvesting, given the COVID right now, are both blended learning approaches, including utilization of online devices. So we have a WHO Academy that is positioning itself to deliver these courses in a number of modalities: face-to-face modalities, self-paced modalities, using mobile to reach those people that are marginalized, together with our UN agencies, the International Telecommunications Union, and the IT Academy. So really, this is going to be a method for us to ensure that the competencies we're expecting, the observable behaviors we're expecting in the digital health ecosystem for everybody, decision makers, tacticians, frontline health workers, are well described and are manifested in instruments of learning, in this particular case, curricula, digital health courses, and etc. So this is really an exciting time for us to be socializing these kinds of topic. Again, digital transformation requires that there is a literate health workforce in terms of digital health and ICT competencies.
Thank you, Derek. I couldn't have said it better. And I know Rupa would love to comment on this, because Women in Global Health is doing so much work also around mentoring, coaching of women, and providing support in terms of the skill set of the future. Rupa, do you want to share a few words about some of the work that you do?
Yeah, thank you. And, one of the main things that we are particularly very excited about when it comes to the digital space and innovation, again, keep echoing this, is that we have problems that we have not been able to solve in global health, right? These are not new problems, but problems around the fact of, women not getting equal opportunities for decision-making, leadership. We know that there's a high level of violence that health workers face, right? The estimates show that 30 to 50% of health workers are facing violence or bullying or some form of harassment in their workplace. We also know that they're not paid equally, with one of the highest pay gaps in all of, compared to other sectors, being around 29% in the gender pay gap. We also know that there is a occupational segregation in this field where women have lower status jobs. So what for us we see in the potential of digital technology and really artificial intelligence going back to some of the points that the speakers here have talked about, yes, there is a role to equip health workers with knowledge and tools and resources, and for them to feel like they're providing better care, quality care. But, my challenge is, again, to everyone is thinking about how do we solve these problems that have been long existing in health using technology more effectively. And it goes back to one, making sure that that everyone in global health, and especially women and girls, are getting exposed to the fact that there is a growth in technology, that there is a place for them to engage, and there's a place for them to engage not only from a women's health perspective, which we know there's a unfinished business. And it was great to hear from my colleagues talking about applications of addressing the maternal neonatal child health challenges we're facing, but also really thinking about how do we have women working on improving technology in a way that it addresses beyond what our traditional mindset is. When we create technology in health, we're often thinking about it from a disease perspective. This is the XYZ disease. Let's go ahead and fix that through technology. But why don't we challenge ourselves to really innovative solutions that address, well, look, how do we create a safe, decent work condition for our health workers? So not only are they getting trained and equipped and more literate, but they are in these workplaces that truly are gender transformative and safe and decent, and that they stay within the workforce and they don't leave the workforce, because we know these challenges in global health, they are interconnected. And so at Women in Global Health, we are, again, partnering, and we use the partnership model. It was great to hear about the WHO network of networks. We are, participating in some of those discussions of how do we co-create networks of networks that bring together non-traditional partners in this space, such as the Women in Global Health Network, exposing many of our members to what's happening in artificial intelligence, and then linking up with private sector partners such as Novartis Foundation to encourage those that have not ever participated in innovation to join startup challenges, to form teams that are multidisciplinary, so that you don't have to be a technical expert. You just have to really have a good problem that you're trying to find a solution to and really work through a multidisciplinary way. And these are some of the ways that Women in Global Health is really approaching this, is let's really make sure that as this field evolves, that we bring to visibility the women that are in this field, two, that we hardwire gender equity, and third, that we really work in partnership to increasing the exposure that that women have in the field of global health to innovation. And then, really joining conversations like this, where many of you are my co-panelists are technical experts. We're really challenging you to not only stop in addressing the disease issue or the health challenge, but really looking at how are we improving overall equity in our society, because that's when things are going to be exciting in technology. Okay, to you, Lucy.
Thank you, Rupa. I'm curious. Both of you actually mentioned something around mindset change. This is which comes across to me a little bit more beyond anything else. It seems that it's COVID-19 above all shifted our mindset quite a lot. And I'm curious, for example, in West Africa, where Kwasi you work, what is some of the biggest learning which you think governments took on board and they're going to sustain? This is a positive big learning and not a negative one, let's hope, for the years after COVID-19.
Yeah, thank you. So on one side is mindset, but on another side is also the way of doing business, and maybe they are related. But what we've seen is that, and I will be very specific in here because I think it's important to learn from the lessons and learn from the activities, and sometimes then they may not be the great activities, but it's still important, and sometimes they are wonderful. So one of the nicest developments that we've had, for example, in Nigeria, where I mentioned before that considerable number of people don't have access to care. Some of the states, they saw the COVID as a wake-up call. And so in the midst of COVID-19, where everyone was focusing on PPEs and all those things, which are necessary, which they did, they actually launched health insurance schemes because they felt that in order to address COVID-19 and the next epidemic, and also address the challenging primary healthcare needs, they really have to strengthen their health system. And one of the important challenges why in Africa we've not been able to provide health for all is the financing. And so they launched the health insurance scheme where Lagos, for example, the state government made millions of dollars available to subsidize health insurance premium. If you go to Kwara State, which is one of the poorest states in Nigeria, they also rolled out health insurance scheme. So, they've seen that we are in a situation where we are because the health systems have not been strengthened. So they did that. When you go to Ghana, where since 2003 they have a national health insurance, and in my view, is perhaps the best on the continent, where the government is financing insurance through taxes, VAT. And so people who 75% of the premium is paid through VAT. There, what they saw is that they got to make it more sustainable. And there are several things that they can do to make it sustainable. One is that they have huge data since 2003, they've been collecting data, whether it's on utilization, is on the quality of care, the outcomes. So they started partnering with PharmAccess to analyze the data and bring out insights, which they can actually use to make the work sustainable. And so the data gave them insights into who has enrolled. In doing that kind of analysis, what they also saw is that teenage pregnancy is an issue. So then they have to address that. And fortunately, the president of Ghana, I think, is the co-chair or the lead on SDG around gender. Yeah, so they actually zooming into that and making considerable changes. In addition to the fact that they are looking at the cost. Ghana, they also did very well where they recognize that COVID is an exceptional situation. So they really need to set up different funds to address that. So these are as far as I'm concerned, they are not only addressing current issue, but they are preparing the countries to be able to address their health needs on a longer term basis. And the examples that I think other African countries can actually learn from. And as PharmAccess, whether it's in Lagos or Kwara or in Ghana, we are in there providing the technical assistance, to make the difference.
Thank you so much for this contribution. It's been quite insightful, and it sparks a very positive path forward, I think, because we often talk about the fact that low and middle income countries have the most to gain, but also the most to lose when we're talking about artificial intelligence in health and essentially a bit more cut-edge technology which is brought forward. With this, I would like to ask each one of you to maybe make one prediction for 2022. I'm jumping 1 year ahead, teleporting myself in the future. And I would love to hear this one prediction from each one of you as to what is going to be this one fundamental change in health for population health with the help of technology that you foresee to happen. Who would like to start? Let's start with Kanishka.
Wow, that's a $1 million question, Lucy.
You can make it.
If I can be the fortune teller or the future teller, I think, in fact, not even one. I would want to add 2 or 3 things here. So one, clearly, and all of us have a role to play in this. I think in come 2022. A lot of the countries, I'm not saying the entire world, but a lot of the countries would be far better prepared to support public health systems through a digital enablement mechanism. There is a lot of work which is already happening in different parts of the world. I'm sorry, this uh, a lot of work is already happening in different parts of the country, and I would expect that, if there is one prediction, one, definitely better data pipelines which can lead to better data analysis, which Kwame mentioned, leading to pushing the needle of the public health systems towards the predictive side of things. I would expect that to happen, instead of just focusing on what happened and why it happened. Pushing the needle of the public health ecosystem towards a zone where the systems can inform the policymakers. This is likely to happen. You might want to take a look at that. And secondly, the
Thank
prediction
you,
is around
Kanishka.
the
That's great. We have 6 minutes, and I'd love to hear from all of you. So I'll take this as a very good promise. So let's hope it happens. Rupa, how about you? What is your one prediction for 2022?
Yeah, so for 2022, it goes back to the fact that we are now acknowledging that digital innovation is a core part of health, and it needs to be both go to scale, and it needs to be really inclusive. So I really imagine that many of the health challenges we are trying to address right now in 2020, including the pandemic, has opened up more opportunities for people that have not engaged with innovation to participate in more innovative collaborations taking place, much more partnership happening. And really, I hope to see that some of this advancement leads to accelerating not only supporting the health workforce, which we've heard really great things about, that every health worker will have access to digital innovation, but also that some of the diagnostic gap that we didn't cover as much in today's conversation, which is another really critical issue of really making sure diagnostic testing gets into the hands of women, and that we have diagnostic testing for the needs of women. I really see that also being acknowledged as part of the potential to harness for 2022.
Thank you, Rupa. Thanks so much. Derek, how about your prediction?
No, I think Lucy, the future is the new normal is most likely going to be more virtual, and I agree in many respects what Rupa was talking about. There's going to be a lot of discussions around investments in digital, and that's why we are preparing ourselves to work on an investment case for digital. The new normal is virtual, and I think that in the coming years, emphasis around making sure that people are not only left behind by means of health programs, but are also not left behind in terms of digital literacy. I think this will be a key issue. And lastly, issues around using predictive analytics, which is what COVID has taught us. But really, I think I agree so much with what Krupa is mentioning. The discussions, I think, next year would be how do we ensure that we have more investments in digital, addressing the issues around broadband, addressing the issues around access, addressing issues around being people-centric, putting people first. How do we ensure that with the people that we are engaging, the health workforce are literate? So really, my underlying statement is that the new normal is indeed virtual, and by virtual means that a lot of investments in digital. Thanks, Lucy.
Thank you. Thanks so much, Derek. And Kwasi, you have the honor to have the last words for the last prediction, last but not least. What is your prediction?
Yeah, thanks a lot. So, there are so many things to be done, but I think that one of the things that I'm so passionate about, and that I hope that more will be done, is the use of mobile technology to transform health. So in Africa, 10% of the transactions are done through mobile payments, compared to 2% in Europe and the US. And so Africa is way ahead on that. The question is how do we invest in that kind of technology to really accelerate access to care? And we're talking about, one, using that technology not only on the delivery, which is important, but using that technology to mobilize different sources of funding, whether it's an insurance or is a donor doing a project, because they are all in there for the benefit of one individual. So how can we use the mobile technology? And I think we are working on that. We've developed a mobile wallet for an individual. That individual can really mobilize all these resources for benefit. I think that's the way to go.
Thank you so much, Kwasi.
I'm looking at the time, so I have to end here.
Great. And with this last minute, I want to express my biggest gratitude to all of you for making this session today, and for the audience to invite them to connect with you and learn about some of the projects, some of the work that you actually do in the field. And thank you again. Wish you a fantastic new year ahead, hopefully, with more positive news on the health care and delivery front. And let's stay connected. Thank you. Over to the team in Geneva.
All right, thanks a lot.
And a big thank you to her for leading such an engaging discussion, as well as to all the guests for all their insights throughout the past hour. Now, we will have to follow up with some of those predictions that you gave towards the end there in 2 years' time at the next Geneva Health Forum. Stay with us, because the next session is going to be at 2 o'clock, and it's very interesting and engaging one, because it's all focused on Geneva at the forefront of the epidemic response. We'll see you very shortly.